Get more on this now with Dr. Ahmed Al-Mandhari in Cairo. He's the WHO's Regional Director for the Eastern Mediterranean. Really good to have you with us, Doctor. We're seeing huge carnage at the site of this hospital. Officials say around 500 people were killed in this terrible attack. We know thousands of people displaced in Israel's ongoing attack of Gaza were sheltering at this hospital, as well as those who were already seeking treatment at the facility. What's your reaction to this terrible loss of life that we've seen at Al-Ahli?
Thank you very much, Scott, for giving me the opportunity. And as you have, nicely mentioned, WHO condemns these sort of acts, regardless of who has taken that sort of barbaric, if I may call it, a criminal act. It is considered as a very, very, bad crime, very sad crime against the humanity. And those people who have acted on that, they should be really investigated. They should be acted upon and prosecuted. In that place, hospitals are considered as the safest place during this situation. Many families have gone there sheltering themselves away from the fight. There are patients, their relatives, as well as healthcare workers. As you have mentioned, there are hundreds of deaths reported. You have not yet received, the final statistics. There are hundreds of people who are injured. Many of them are women and children, and as well as healthcare workers. So it is really very unfortunate. It is very bad sort of crime that is targeting hospitals, healthcare facilities, and the people inside these facilities.
And Doctor, we know that hospitals in Gaza were already under a lot of pressure even before Israel's latest attacks on the Gaza Strip. This has just made things worse, hasn't it, in terms of medical supplies, in terms of the capacity for the hospitals in Gaza to provide treatment for the growing number of people who've been injured?
Exactly, as you have mentioned, even before this escalation, the health system in Gaza is really suffering from a lot of, deficiencies. Healthcare workers who are exhausted, tired, their numbers is really reducing. Medical supplies and, facilities themselves the infrastructure is really weak. This sort of escalation the attacks on healthcare facilities added to the complexity of the weakness and the fragility of the health system. There are around 134 attacks on healthcare facilities reported by WHO in Gaza and in the West Bank. These sort of attacks led into, 15 deaths among healthcare workers, many injuries, tens of injuries among patients and the healthcare workers, targeting and affecting, more than 70 ambulances. In addition to that, there is a target of the infrastructure like water, electricity supply. In the northern part of Gaza, there are 22 hospitals. 4 of these hospitals are non-functioning because of the direct attacks on these hospitals.
And we know that Israel has cut off all electricity and water supplies to Gaza. We're waiting for the Rafah border crossing between Egypt and Gaza to be open so that critical aid supplies can finally be taken in to the Gaza Strip. That, of course, includes much needed medical supplies, which are now fast running out. How important is it that this border crossing be opened in order to allow for the delivery of this aid?
It is very important, Scott. This was our goal from day one, to make sure that cross-border is opened, and provide medical supplies, humanitarian supplies like food, water, and fuel, as well as make sure, those who are injured in that area with severe, badly, damage, be evacuated to neighborhood countries to provide them services. The situation is very critical. The more we continue closing that border, I assure you, the more innocent lives we are losing among children, women, elderlies, those sick people who are suffering from different type of diseases like renal failures, cancers. So there is a huge critical risk. The more we delay, the more lives we are going to lose.
Okay, Dr. Ahmed Al-Mandhari from the WHO. We will have to leave it there, but the very best of luck with your work, and thank you so much for joining us on TRT World.
Appreciate it. Thank you.